Hi, everybody. Dr. Ellie Stein here with my video tip of the month for October 2025. The topic is medical gaslighting, and I'm calling it 6 Ways to Protect Yourself. Over my decades in medical practice, I have heard innumerable heart-wrenching stories from patients who have gone to doctors and other healthcare professionals seeking help for concerning health symptoms only to be dismissed and invalidated. Here are some examples of what practitioners have told patients. I don't believe in fibromyalgia. It doesn't exist. You look fine. Or I get tired too. Sometimes they're given a diagnosis of medically unexplained symptoms or somatic symptom disorder. They're often told your test results are normal. I don't see anything wrong. Or perhaps you're old, stressed, in menopause, or it's due to some other medical condition, sleep apnea, thyroid, cancer, etc. There's no way out of these situations for patients. If they become upset with the professional's incorrect conclusion, this is taken as evidence of emotional imbalance or mental health symptoms. And the consequences of invalidation is serious. Healthcare professionals are the gatekeepers of the medical system. If your practitioner doesn't believe or understand you, then access to needed care and social supports may not be available. So, what is the actual definition of medical gaslighting? The earliest record I came across of the term is in a 2018 article in The Atlantic magazine. They defined medical gaslighting as when healthcare professionals downplay or blow off symptoms. Now, the more technical research-based term is behaviors which invalidate or call into question the authority of another person to judge their own lived experience. So basically, with gaslighting, people are being told that their experience or their interpretation of their experience is incorrect. I have had this happen to me on many occasions, and I know it does not feel good. When this happens, I don't want to work with that professional, and I certainly don't trust them to help me. So the question arises, why is medical gaslighting so common for people with complex chronic diseases? Is it that medical professionals are insensitive? Is it that societal values don't support people with hidden disabilities? Is it some combination of these? From my research, I've found 4 main categories of factors that impact the opinions and behaviors of healthcare professionals, and all of these are drawn from the medical literature. Number 1 are societal factors, and this is huge. Unconscious stereotypes are widely held in society, and healthcare professionals are just as prone to harboring these unconscious biases as anyone else. So, as a result, invalidation or medical gaslighting is more likely to occur if you are someone from an underrepresented group. This may include women, racialized groups, people who are neurodiverse, LGBTQ, and people with visible and invisible disabilities. This invalidation is increased by a society which values doing over being, and outward evidence of success, doing things that are bigger, faster, higher, etc., rather than the quiet daily struggle of people with chronic diseases to survive. Furthermore, conditions that don't have gold standard diagnostic tests, of course, this includes ME/CFS, long COVID, fibromyalgia, chronic pain, environmental sensitivities, and others. These conditions are less valued and more stigmatized than diseases with gold standard tests, things like heart disease and cancer. Many people believe that if we don't have a test, if we can't measure something, it doesn't exist. And this incorrect assumption harms many patients. The second category of factors has to do with medical education. I won't go into depth here, but suffice to say that despite decades of advocacy by patient partners around the world, A 2022 survey by Victoria Reid and Nina Muirhead of Cardiff University in the UK found that 88% of medical students had not been taught about ME/CFS, and none of them, 100%, had not been examined on the topic. I can tell you, having been a medical student, that if I know something's not going to be on the exam, it doesn't get my attention. Now, personality and ego also play a role. Healthcare professionals, and perhaps physicians in particular, are taught that they need to have all the answers and never miss a diagnosis. This puts them in a very difficult position when they don't have the answer. And unfortunately, rather than admit that they don't know what's going on, practitioners tend to blame patients. Third big category is how medical services are delivered. There are big problems in this regard, and part of it is that there's no specialty home for complex chronic diseases. Patients often get referred to 5 or more specialists before they get diagnosed. We are medical orphans. Additionally, doctors get paid to see somebody for 7 to 10 minutes. If a doctor takes longer with a patient, they earn less. And if this continues, they often don't earn enough to pay their staff and expenses. So if there's a sign in your doctor's waiting room saying something to the effect of, "Please keep your visit to the discussion of a single complaint," it's probably due to their financial constraints rather than them not caring. There are more and more excellent guidelines for various aspects of complex chronic diseases, but unfortunately, most practitioners are not aware of them. Doctors are scared to practice out of bounds. Many of my colleagues in Canada have been persecuted by their provincial colleges for practicing, and putting this in air quotes for those of you listening, outside of accepted norms. Now, the problem is that the accepted norms rarely mention complex chronic diseases. So any doctor who's knowledgeable and is providing good care for us is probably doing so at the risk of censorship. The fourth big category of factors is the power imbalance between patients and practitioners. Now, this can be very subtle, but it is always there, and it makes patients feel that they don't know as much as their practitioner. Patients seek medical care when they're unwell, scared, and vulnerable. And vulnerability makes you feel less in control, even if in the rest of your life you have wealth, position, or status. The power imbalance results from the practitioner having more knowledge. Now, even though you are the expert on you, even very informed patients don't typically have the same breadth of knowledge as most practitioners. Patients reveal private, sensitive information to their practitioners, but the reverse doesn't and shouldn't occur. This causes an imbalance in power. And lastly, as I've already mentioned, practitioners are the gatekeepers for much needed resources. They can order tests or treatments as they see fit, and this places patients in a dependent position. Patients quickly learn that they need to act in certain ways to increase the chances that their practitioners will believe and assist them. So, are there any solutions? Many of the problems I've laid out are difficult to change. They require groups of advocates to lobby the organizations who make the rules and to work towards changing the social structures that maintain the invalidation of our experiences. But there are things you can do as an individual to protect yourself while the system catches up. These are 6 suggestions. I'm interested to hear what you think about them. So, suggestion number 1, I'm saying it with a bit of a smile, don't hire a carpenter to fix your toilet. So, in episode 14 of the Dr. Eleanor Stein podcast, Dr. Afret Lamandra, she goes by Dr. E or the medical disruptor, Explain that most conventionally trained practitioners don't learn about complex chronic diseases. So, asking them to help you with your environmental sensitivities, your mast cell activation syndrome, or your SIBO is like asking a carpenter to help fix your leaking toilet. The carpenter doesn't have the training or tools. They are unlikely to find the source of the problem. And even if they work on it, sometimes for hours, chances are your toilet's still going to be running. So, for those of you who are able to do so, try to find practitioners who are plumbers, meaning people who know how to assess, diagnose, and treat complex chronic diseases. I understand that this is difficult if you're living on low income, you don't have access to good transportation, and you live in a remote location, but it's the ideal. Number 2, share accepted clinical guides with your healthcare team. Make sure that they have the information that you want them to have at their fingertips. To this end, I've created a one-page PDF document for healthcare professionals. It has links to the most current and widely accepted guidelines for MEFM and MCS. You can access the PDF partway down my homepage. My recommendation is to read the guide yourself first, find and circle the parts that pertain to your experience. Give your practitioner the entire guide, but make sure you point out the part that you especially want them to consider. Spoon feeding is a useful strategy when asking for something from a busy healthcare professional. Tip number 3, hold your practitioners accountable. Now, an example of how you might do this would be if a doctor refuses to run a test that you believe is warranted, they won't support your disability request or a needed referral. You could ask them to record both your request and their answer to it in the medical chart. They may rethink their reply knowing that you will hold them accountable. Number 4, if gaslighting is particularly egregious and harmful, you may consider placing a complaint with the college or board that registered and polices the healthcare professional in question. I consider this a last resort because it takes energy and effort. The process of lodging a complaint is not easy, and the system can be biased in favor of the practitioners. Nevertheless, if several complaints come in about a particular practitioner, way of practice, it may encourage change. So it can be a form of advocacy. Number 5, for those of you who are listening and not watching, picture me with my fingers in my ears humming. So this tip is, your comments don't affect me. If you are gaslit by a healthcare professional, remember that their beliefs and behavior doesn't change the validity of your experience. They can say what they want, they can deny you access to tests or services, but they can't steal your dignity or self-confidence unless you let them. So please don't. Lastly, find support. If you're feeling shaky, you wondering, are you the only person that this has happened to? Talk to people who will believe and support you. Moving ahead towards your goals of better health is much, much easier if you're not alone. So find others with similar health challenges and with whom you can pool your knowledge and resources. Some suggestions. Look for a group with a positive outlook. One such group is my private Facebook community. I recently got an unsolicited email from someone who told me that that group really helped her. Alternatively, you may want to join my subscription-based membership. It's called Live with Dr. Stein. We meet live on Zoom every 2 weeks, and I teach practical ways that you can improve your health, and the strategies are things that you can implement without reliance on healthcare practitioners. I hope this understanding of medical gaslighting is helpful, and that the 6 tips are things that you might consider implementing if you're unfortunate enough to be experiencing medical gaslighting. I would love to hear your experiences, and especially, I'd love to hear your tips if you found a strategy to help protect yourself, or better yet, even prevent medical gaslighting. Please share it with the community.